A new report says that most amputations done on Canadian diabetics could have been prevented with better access to health care. The report says over 7,000 diabetes patients undergo a leg, foot, or toe amputation every year, and that the diabetics living in low income neighborhoods are 3 times more likely to have an amputation. Geoff Hynes, manager of population health at the Canadian Institute for Health Information, unpacks this further.
Typically, diabetes is an issue with people have challenges regulating their blood sugar. Okay, and so for somebody who has like unmet needs for diabetes or poorly regulated blood sugars, those high blood sugar levels, they can cause serious damage in your blood vessels, in your legs, hands, and feet, in your extremities. Okay, and so over time, you have that damage. It causes nerve damage. It can promote another condition called peripheral arterial disease. When you have diabetes and peripheral arterial disease, they really have a major impact on one's ability to have blood flow in those areas. And so, for a normal person, if you have a cut or a scrape on your foot, you've got good blood flow, that will heal and it won't be an issue. If you have diabetes and you have poor blood flow, poor circulation that may be exacerbated by smoking, for example, that little cut may not heal. And over time, that can grow into what we call a diabetic foot ulcer. Okay. And that is a very serious issue because more than 80% of amputations are preceded by an ulcer. And so, really, what we're talking about is high blood sugars, other risk factors that exacerbate the condition, and it really leads to just poor circulation and then poor healing. And it's really a terrible condition. And in terms of preventing, I think there's a whole number of things, right? Obviously, first of all, you want to support people in not developing diabetes, right? And so that comes with, trying to, eat good foods, maintain a healthy weight, exercise. But that may not be enough for some people, right? And 10% of the Canadian population has diabetes. So this is a pretty prevalent condition. So if you can prevent it, great. But if you can't, well, ideally, you want to have a primary care doctor who's helping you manage your condition, right? And so one of the challenges with diabetes is that a lot of the management is self-management, right? And so you've got a GP that you meet periodically. Ideally, they're checking your blood sugars. They're checking your cholesterol. They're checking your blood pressure and cholesterol, but they're also doing foot checks and vision screening, right? Because your eyes and your feet are two areas where, as I said, that vascular disease is very problematic. That's where you see people with diabetes developing glaucoma, for example, and unfortunately, amputations. And so having that good primary care is really important. And if you do have an issue, you want to be seeing a foot care specialist because those are the folks, podiatrists and chiropodists, they recognize these problems and they can see them early and they can get you referred to the specialists who then can, follow up with treatments, hopefully that can, intervene before you end up requiring an amputation. Yeah, I think so. My team at Canadian Institute for Health Information, we're very interested in population health and health equity. And so, one of the things that we understand about diabetes is that this is a disease that has a lot of health equity challenges, right? And so, for these conditions, what we advocate for is, managing those conditions through the lens of health equity. And so, what that means is you're thinking about, your patients individually and what they have in terms of the social challenges, the economic challenges, the geographic challenges. And so, what we see in diabetes, for example, much higher rates of amputations in individuals who live in low income areas, individuals with low education, individuals who live a very socially isolated lifestyle, and people who live in rural, remote areas. And there's a few things that kind of pervade all of those issues, and that really tends to be, challenging. It challenges getting access to primary care, right? And so, if you, as I said earlier, if you don't have good access to primary care, then you're really on your own in terms of managing your condition, and that is not a good thing. There are also other challenges that people have. I mean, if you have a low income, you may have difficulty making ends meet. And so that may impact your ability to afford certain types of care that are not publicly funded. So foot care, for example. Also, you may be working in a job that doesn't afford you the opportunity to say, okay, I need to take some time off work so that I can rest my feet. So you may have to power through and work through. And that is not good when you need to relieve pressure on a diabetic foot ulcer. There's a whole range of things I think that contribute and put people at a disadvantage. And what we advocate for is that as you're thinking about how you're going to treat and manage diabetes, you really need to think about what are those challenges that those individual people have, right? We know what works, but it may not work for everyone. There's no one size fits all.